Introducing another gender doctor. And I think as you watch this video, you will be shocked at the way in which this doctor is able to first admit that there's no research to back up the kind of treatments he's providing to children, and then coerce families into accepting these treatments that have long-term side effects and unknown consequences.
Hi, I'm Rob Garofalo. I'm the head of the Division of Adolescent Medicine here at Lurie Children's. When we started our program in 2013, I should know this, but I think it's 2012. I think we had 12 kids that we took care of, and it was just me. We had no funding. Thanks to Jennifer Pritzker, again, we were able to form a very comprehensive model.
For those who don't know Jennifer Pritzker is a male who identifies as female, who has a lot of money, and who is systematically supporting the transgender movement.
But I think last week we saw our over 650th patient. So we see about 20 new patients per month. We have a 5-month waiting list.
In most cases, if there was an explosion of a health issue such as this, there would be extreme concern. This is an epidemic of kids suffering from gender dysphoria. And rather than expressing concern and trying to figure out what's at the bottom of this, we have doctors like Robert Garofalo who are celebrating it and excited about it, probably because they're making a lot of money.
When I think about what the core function of a pediatrician is, for any child, whether or not they identify as trans or not, it's really to promote the physical, social, and sort of mental well-being of a child.
If it is a physician and a pediatrician's responsibility to promote the physical health, the mental well-being of children, there is no justification for these gender clinics. They are advocating medical interventions for children who have gender dysphoria that physically disease the body. So they're taking healthy children's bodies and causing them to be diseased as a result of these interventions, resulting in lifelong side effects and rendering these children's healthy bodies dysfunctional.
I'd like to think most healthcare providers are really grounded in wanting to make their patients, lead healthy and happy lives.
I agree, doctor. Ideally, that is what should be happening. But because of doctors like you, children are not receiving appropriate health care. They are instead being convinced to engage in treatments that damage their bodies and that do not address the underlying causes of their gender dysphoria.
The treatment recommendations really are based upon best available evidence, which is very little.
So this doctor openly admits that there's very little research to justify these interventions, and yet he is still pushing them. Not only is he pushing them, he's actively recruiting children to his clinic. Listen here while he describes a program that he has where somebody goes into the schools to educate children about these issues. Basically, he's sending somebody into the schools to recruit children to his gender clinic.
We thought about nurses and we thought about doctors and we thought about mental health professionals, but we didn't realize that really where most kids, live and breathe and function is in schools. And so Jen Leiniger on our team ended up being like the most important person that we had in our program, because she was the one person that was designed to go into schools and educate them and teach them and sort of move them forward. And what's interesting there is, classic medical providers, we didn't think about that full range. And really, I would say by and large, that school piece almost singularly was the most important facet of our program.
Many of us are concerned about what we would consider very liberal guidelines by the Endocrine Society. And yet, here, Dr. Garofalo is suggesting that they are too restrictive, and in fact, his clinic doesn't follow them. These guidelines recommend no hormonal transitioning for children under the age of 16, and yet at his clinic he openly admits that he treats children with cross-sex hormones who are as young as 13 years old.
Now you're seeing people starting cross-sex hormones at 15 or 14.
The Endocrine Society, again, has guidelines here, although I think they're not guidelines that typically most places that do this work progressively adhere to. In particular, they indicate that someone should not start these hormones any earlier than the age of 16. Most places, at least in the U.S., have not adhered to these particular principles. So we generally will initiate potentially cross-gender hormones at younger ages, as young as 14, even 13 in some rare cases.
What is tragic is kids as young as 13 years old being given cross-sex hormones when doctors readily admit that they have no idea which of these children are going to be adults who maintain their transgender identity and which of them are going to desist. Knowing that the vast majority of children who have gender dysphoria grow up not to be transgender adults, that means they're treating the majority of children with these harmful interventions to treat just a few who might go on to have a trans identity as adults.
When we think about what the trajectory of these children could be over the course of their career, what does a gender nonconforming child look like when they become an adolescent? We know that they could grow up to be a transgender adolescent or someone who's genderqueer or a sexual minority youth, but they could also grow up to just be a plain old simple heterosexual young person or an adult.
Did you notice how he just said plain old young person or adult, suggesting that being a heterosexual and being non-transgender, being non-queer is akin to being just plain old? No wonder these kids are transitioning, because who wants to be a plain old adult when you can be a queer adult or a trans adult?
So we don't really have a good understanding of yet of an ability to predict which children are going to end up in sort of which box. So any person or any clinician that's going to stand up here and tell you that they can predict with 100% certainty which children are going to grow up to be sort of transgender, I'd tell you that they're lying, because I have been fooled. I mean, I've been doing this work for a long time, and there have been kids that I am convinced I know are going to, persist in being transgender, and then I'm wrong.
So he admits that he's treating children even though he doesn't know if they have the condition for which they're being treated. Now, it'd be one thing if these treatments were benign, but they are not. They have serious, long-term, lifelong consequences, and yet he minimizes that, even as he is acknowledging that he has no way of knowing which of these kids actually are going to grow up and have a transgender identity, knowing that the vast majority of them are not.
It doesn't really matter to me whether children end up being transgender versus less being transgender. What matters to me is whether these children end up being happy as their authentic selves as adults.
He may not care if a child grows up to be trans or not, but the fact that he is giving them medical treatments knowing that they may not is unconscionable.
Social transitioning remains somewhat controversial, in part because, again, there are very few outcome studies related to whether social transitioning has positive or negative outcomes for these children in the long run.
Again, he openly admits that he doesn't really know whether or not these treatments are going to be beneficial. And he also doesn't ever explain what an authentic self is. And until we have some kind of an assessment for what authentic self is, we shouldn't be treating children as if there is such a thing.
So we think, at least, that early treatment can lead to sort of better physical and psychosocial outcomes. But do we know that? Not really, because right now the outcome literature on these young children is scarce.
How can you be treating children when you don't even know what the outcome is going to be? How is this legal? How can these doctors be getting away with this? They are medically abusing these children with no data to support these treatments.
Access to care saves lives for these children.
And then he has the audacity to suggest that access to care saves lives after he just said that there's no data to support this contention. He's arguing for these treatments without any research to support their benefit, and then he's suggesting that these kids need access to this care and going into schools and recruiting them to his clinic.
We do consider these safe. Again, GnRH agonists have been used in other conditions like precocious puberty for many years and are considered safe, but we do not have a good understanding of the long-term outcomes within this particular context. Some of the potential risks really that are not fully studied relate to sort of bone density, height, And then the impact on sort of cognitive or sort of brain development.
Some of the risks might be on height, bone density, and cognitive brain development. The way he just sort of minimizes that as a risk is unreal to me, that he can just sort of roll that off as, it's possible that these kids will have long-term brain developmental issues, but we're still going to move forward because we're not quite sure what those are going to be. And we're so firmly entrenched in our ideology that we don't want to consider that we might be damaging these kids for life.
There aren't like a tremendous amount of studies that have been done to document like all the potential side effects and the risks and benefits.
Here he is encouraging parents of a child to transition. These parents are concerned about their daughter and not excited about the concept of engaging in medical treatments that are untested and unproven. And yet he really minimizes the risk and really encourages them to move forward with this treatment, despite the fact that their daughter expresses a desire to one day have children of her own.
I mean, there definitely is the potential for the testosterone or the cross-sex hormones to prevent sort of normal, what do we call normal fertility to sort of occur.
Have you ever thought about having kids yourself?
We're sort of asking you to be really grown up really quickly. We know very little about things that are really important to families, like fertility, like cancer potential or oncologic potential of these agents, cardiac risk. I mean, things that are like families want to know when they're making decisions about their children.
I would like to have kids, maybe someday, but...
The other thing these gender doctors do is they start children on puberty blockers as young as 8 or 9 years old, and they use that as a justification to start them on hormones earlier because they don't want kids to be on puberty blockers for a long period of time. In fact, puberty blockers have been shown to cause severe side effects if used for more than a year. And so the goal is to get them off the puberty blockers and onto cross-sex hormones. The problem is they're starting kids on puberty blockers at such a young age that now they're justifying using cross-sex hormones at an increasingly earlier age.
Young person who might be blocked in their pubertal development at the age of 9, would you really keep them blocked until the age of 16 before you would allow them to go through puberty?
So when you move on to cross-sex hormones, you're now initiating medical therapy where some of the changes that are going to take place are permanent. And that's a whole other like ball of wax, I think, for some of these families, and that can be really hard.
Dr. Robb also says that many of the patients come in and they've already diagnosed themselves and they already know what treatments they want, indicating that they're getting this information from somewhere. And he celebrates them as activists' children. And yet these are children who have gotten misinformation and are now wanting to damage their bodies. And any parents who are hesitant about these treatments are sort of deemed regressive and he feels like it's his job to sort of help them get on board with these treatments for their kids, even though he knows that there's no medical research to justify these treatments and we don't know what the long-term outcomes are going to be for these children.
I mean, I would say 80% of the young people that come are often really activist in their mindset and come dragging their parents to the medical visit. You know, a lot of the time these young people know what they want and they are trying to move the process along as fast as possible. And sometimes parents will come in and be like, you know, what is I want to make sure that my young person is, that my child's really trans, you know, can you help me with that? And I'll turn to the child and be like, yeah, so, you know, what gender identity do you have? You know, there's no form, there's no scale, there's no psychological battery of tests that needs to be done. Really, the young person can answer that question for themselves. And sometimes that's news, I think, you know, to parents, you know, that, you know, think that they're going to come in and have this evaluation that is going to help determine their child's gender identity, when really our work sometimes is just getting them to recognize that anyone's gender identity, be it trans or otherwise, is a normal variation, you know, and it's not an affectation. It's just a normal part of the human condition.
Suggesting that invasive medical treatments are just a normal part of the human condition is just absurd. And he readily admits here that he is treating kids based solely on these children's idea about what they are. I can't think of another case where a child would go to a doctor and get exactly the kind of treatment that they wanted without any kind of assessment or testing or some kind of some kind of way of determining whether or not they actually needed that medical treatment. In this case, all Dr. Rob does is look at the child, ask them what gender identity they are, and then runs forward with medical interventions.
Families that just don't know what's the right thing to do. They're afraid that there isn't like a strong evidence base, that they're afraid that they're making the wrong mistake. We've never come across a case that we couldn't work with families to move them forward.
He talks about moving parents forward. What he's talking about is bullying and coercion. He is telling parents that if they don't agree to these treatments, something really bad is going to happen to their children. Often these doctors tell parents that their children are likely to commit suicide if not allowed to access these treatments. This is bullying and coercion and is inappropriate in a medical setting for any kind of medical treatment, but especially for a treatment that has no research to justify its use.
You know, a lot of parents will come in and really think about like, well, is it safe for me to move forward, you know, like with my child with some of these interventions? And I often, you know, turn it on them in a safe way, but to say like, well, would it be safe for you to not decide to allow your, you know, child to live their life as their authentic selves?
Dr. Rob talks again about parents needing to affirm their child's authentic self. I don't even know what an authentic self is.
So there are things that we do not know about the process. There's not a full range of evidence to support the treatments that we're using.
We're asking families to take some leaps of faith based upon the child that they have in front of them and really what we don't know with regard to some of the long-term consequences of these medications. I don't envy these parents. I mean, I think they're making decisions in a very difficult environment. How realistic is it to believe that a 14 or 15-year-old or 16-year-old has really the capacity to make that kind of decision for him or herself?
How indeed, Dr. Rob. How is it that you can expect these children as young as 13 years old to understand the long-term consequences of medical interventions that we don't even have long-term data on? You're basing these interventions solely on a child's sense of their authentic self we don't even have an assessment for.
This is a movement that is happening. It's not going to not happen. It's going to happen.
I've been told plenty of times things that I couldn't do, but I never listened.
Well, maybe you will start listening as these children grow up and make heartbreaking videos about their desistance, about their detransition, about the long-term effects that their bodies have as a result of medical interventions that you recommended, that you pushed, that you bullied their parents into accepting. I pray that it will stop before then, though. I pray that these doctors will realize that they are harming these children, that this is unconscionable. And I hope that as a community, as a society, as a world, we stand up and say no more. No more experimenting on children. No more medical maltreatment of those who have mental health issues. What's happening to these children is not much different than other unethical medical experimentations that have taken place in the past. We've had children with mental health issues given lobotomies. We've had them institutionalized. We've had them subjected to horrible mistreatment. And again, we are doing it. We need to stand up for our children and stop this now.